Welcome back. We know health insurance companies do not always fully understand the evolving needs of people living with rare medical conditions. In this video, we will discuss the second question you should ask when choosing a health insurance plan. How much does the plan cost? When calculating the cost of a plan, it's important to remember that there are two types of expenses associated with health insurance. The first is your monthly premium, or the amount of money you pay up front each month. The second is out-of-pocket expenses, which are the fees you pay when you receive medical care. In general, the higher the premium, the lower your out-of-pocket expenses will be. Here's how it works. Plans sold to individuals are divided into 4 tiers: bronze, silver, gold, and platinum. Bronze plans have the lowest premiums, but only cover 60% of the average member's total healthcare costs. Silver plans cover 70%, gold plans 80%, and platinum plans cover 90% of healthcare costs while having the highest premiums. Of course, choosing which tier insurance to buy depends on your specific needs. If you have an expensive medical condition, as is the case with most rare diseases, the gold or platinum plans would probably suit you better, as they would cover more of your costs. Out-of-pocket expenses, also called cost sharing or out-of-pocket costs, refer to the portion of your medical bills which you are responsible for paying when you receive health care. Every plan is different when it comes to your out-of-pocket expenses, so be sure to compare the different plans on your state marketplace or ask your employer for a summary of benefits and coverage form. Out-of-pocket expenses can be paid in some combination of deductibles, copays, and coinsurance. Your deductible is the amount you must pay every year before your insurance company starts paying its share of the costs. If your deductible is $2,000, then you would pay cash for the first $2,000 in health care you receive each year, after which the insurance company would start paying its share. In every plan, preventative services will be covered in full, even if you haven't used up your deductible for the year. Some plans will also pay a portion of your costs for a few other services, usually doctor visits and prescription drugs, even before your deductible has been met. This is more common with gold and platinum plans, but some silver and bronze plans also cover some services before the deductible has been met. The only way to figure out whether a plan covers some services not subject to the deductible is to study its provisions very carefully. Your copay is the fixed dollar amount you pay for certain types of care. You might pay $30 for a doctor visit, and the insurance company will pick up the rest. Plans with higher premiums generally have lower copays, and vice versa. Some plans do not have copays at all and use other methods of cost sharing. Coinsurance is the percentage of the cost of your medical care that you have to pay. For an MRI that costs $1,000, you might pay 20%, $200. Your insurance company will pay the other 80%, $800. Plans with higher premiums generally pick up a larger portion of the bill. On a final note, every insurance plan has an out-of-pocket limit, which is the most cost-sharing you will ever have to pay in a year. It is the total of your deductible, copays, and coinsurance, but does not include your premiums. Once you hit this limit, the insurance company will pick up 100% of your costs for the remainder of the year. Plans with higher premiums generally have lower out-of-pocket limits. The specifics of what an individual health insurance policy covers, the cost of premiums, the level of deductibles, and the requirement for copays will all vary from policy to policy. If your rare disease requires the care of specialized physicians and long-term therapy, you really want to choose a plan that helps you to be well and have access to that care. Thank you for watching. Additional insurance information can be learned by viewing the 3 other videos in this series. They may be found by visiting NORD's website at www.rarediseases.org.